Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lori Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit, and how to navigate health issues in the healthcare system as you age, so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lori Gardner. Welcome back to Don't Let the Old Lady In podcast. I'm your host, Lori Gardner, excited again to get some more hospital safety information to you so that you become empowered and help yourself or a loved one when they're in a hospital stay safe and sound. Today, we're talking about something that is incredibly common, I should say, in hospitals and often overlooked: catheters. Now, on the surface, catheters seem helpful, right? They make things easier for the patient, for the staff, for monitoring, and sometimes they're absolutely necessary. But here's what most people don't realize. Catheters are one of the leading causes of hospital-acquired infections, and I spoke about that a couple of episodes ago. But even more important, many of these infections are preventable. And the key often comes down to one simple question: do we still need this? So let me walk you through a situation I've seen many times. A patient is admitted to the hospital. Early on, a catheter is placed. Maybe it was needed during surgery for monitoring because the patient couldn't get up easily. And initially, it makes sense. Days go by. The patient starts to improve. They're more awake. They're more stable. But the catheter is still there. No one has really questioned it because it's easier to leave it in. And then something changes. The patient becomes more confused, more uncomfortable. Maybe they develop a fever, and eventually it's discovered they have a urinary tract infection. And families often say, I didn't even realize that could happen from that. Well, let's break this down simply. A urinary catheter is a tube that drains urine from the bladder. It's useful and very useful in certain situations, but it also does something important. It creates a direct pathway for bacteria to enter the body. And the longer it stays in, the higher the risk of infection. So, let's talk about why this happens. The catheter bypasses the body's natural defenses. Bacteria can travel along the tube. The longer the catheter is in place, the greater the chance of infection. Even one extra day matters. So bacteria can form a layer on the catheter surface. Did you know that? And that makes infections harder to treat. Patients may not feel the usual urge to urinate with that catheter in, so changes go unnoticed longer. So here are some signs of a UTI, urinary tract infection. Sometimes the symptoms are obvious, sometimes they're subtle, especially in older adults. Watch for fever, burning or discomfort, cloudy or strong smelling urine, increased confusion, restlessness, and they're just not themselves. The last one matters more than you think. I have had countless elder clients who didn't have any of the symptoms of a UTI that you would typically think of, the burning and fever or cloudy urine, smelly. They just were a little confused. Or they were a lot confused, or they just didn't feel like themselves, and the first line of defense for me is I want to rule out a urinary tract infection. So this is where you become incredibly important. This is the most powerful tool and the most powerful question to ask every day. Do we still need the catheter today? It's simple and it's incredibly effective. Simply ask, why was it placed? You should know why it's placed in there and how long they plan on it being in there. But ask the question, what needs to happen before it can be removed? Sometimes people have it put in after surgery, and it's a situation where when it comes out, you really have to hope that bladder starts up right away. Sometimes it doesn't. So the longer it is, the way I put it is the lazier the bladder gets. So we don't want that to happen. So if it's no longer necessary, just speak up, because removal equals reduced risk of infection. And make sure the positioning is correct. That bag that's collecting the urine should be below the bladder. And make sure the tubing is not kinked, okay? Because that can cause backup, and that's a problem. You can also be educated on the hygiene for having a catheter in. What should we be doing to keep the area clean? Should we be doing anything? What do you do to keep the area clean? I'm just curious. And here's some, again, I like to offer some scripts and sentences you can use to inquire. One could be, do we still need this catheter? Another can be, can we talk about removing this? Why is it still in? Or what's the plan for getting it out? What could happen after it comes out? What should we expect? Or you could say, I notice some changes. Can we check for infection? I'm just a little bit concerned. Here's where families hesitate. It's just easier to leave it in. And yes, it is easier. But easier is not always safer. And we are about being safe. So instead of thinking it's helping, think, is it really necessary? So in closing, I want to share that catheters are one of those things that start out as helpful, but can become harmful if left too long. And the difference often comes down to awareness, asking one simple question, speaking up at the right time. Because sometimes removing something is what protects healing. So now you know what to ask, what to watch for, and when to speak up. And with that, again, check out, I'll leave in the show notes, the link to the carepartnerproject.org site, where you can download a checklist of what to look for, or just know the URL and look at it when you're in the hospital. You can pull it down on the phone. So I hope this was helpful, ladies, and I hope anybody, and yourself included, that ever get in the hospital, stay safe and sound, because you've been educated. Share this with everyone. Everybody needs to know this information. And until next time, what am I going to say? Don't let the old lady in. Keep her healthy, keep her out of the hospital, and keep her safe. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion will truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.